Good morning, students. We are continuing with the previous day class. In the previous class, we have discussed about the true experimental design. In the true experimental design, in order to satisfy the design, we need three important criteria. That's what we have discussed in the previous class. If all these criteria is there, that design we call as a true experimental design. So today we are going to discuss about what are the important true experimental designs are there for the nursing studies. Now, the most commonly used true experimental design, we call it as the pre-test, post-test design or before-after design. So why we call this as the pre-test, post-test design is before the intervention, we do a testing, and after the intervention, we do the testing again. That is why the name as the pre-test, post-test design or before-after design. Again, in this particular design, we randomize all the subjects into two groups. We randomly allocate subjects into experimental group and control group. And most of the time, most of the studies, this will be equal in strength. Example, 50 in the experiment and 50 in the control. We randomize them into that according to the power of the study and according to the sample size calculation. We estimate that. And after randomization into two groups, we will do the pre-testing of both the groups. For example, study can be conducted with an educational intervention, or sometimes the study will be conducted with a drug testing or a vaccine trial, or it can be testing of a beauty product, aesthetic product. It can be anything. Intervention can be anything. So just before the intervention, we will see if the knowledge, attitude, practice is tested, we'll do a pre-testing of that. If you are going to test the efficacy of a drug in improving anemia, improving hemoglobin level, we'll do the pre-testing is the testing of hemoglobin level of antenatal mothers. So the pre-testing will be done, and after that we will give the intervention. And pre-testing is done for both experimental group and the control group simultaneously. And the intervention is given only to the experimental group and no intervention to the control group. There are sometimes some problems can occur. For example, we are dividing 50 patients and another 50 patients in the control group. And if you're giving the drug only to the experimental group, there can be some doubts, conflicts, and issues can be there why the drug is not given to the control group, to some patients. So in that case, whenever we give an intervention or a drug to be tested to the experimental group, we will give a placebo intervention to the control group. The placebo, the word placebo, you might have learned in your psychiatric classes or you will be learning. Placebo means it's an inert substance that have no action at all, but have all the characteristics of a true intervention. That is a placebo. For example, sometimes to a patient who complains always aches and pains and wants some injection, but the doctor, the physician know that there is no other complaint for the person, and only for the psychological satisfaction of the patient, they'll give an injection aqua. That means a plain water or distilled water injection. And the patient will be satisfied. This is a placebo therapy. So, the intervention to the experimental group will give the true intervention. That also, while giving the intervention, the researcher should know so many things about the intervention. That means what is the dosage of intervention, how frequently the intervention is given, who will administer the intervention, what is the effect of intervention, and what are the side effects of the intervention to be observed. So all these things, an awareness is needed for the investigator, for the primary investigator and the secondary investigator related to the intervention. And according to the plan or according to the protocol, they should give the intervention. And again, the protocol will mention about after the intervention, what is the time period for doing a post-test. For example, if you want to test the knowledge immediately after the intervention, you can do that. But attitude, normally we do the post-testing after 1 week. And the practice will do the post-testing only after 1 month, because that need time for the changes to take place. So the protocol will mention when we can do a post-testing. And according to that, we'll do the post-testing in both the groups. So this is the design of the study. We have 2 groups in the true experimental design, pre-test post-test design, experimental group and the control group. And the control group is actually, the function is for comparison, to see whether the changes are taking place in comparison to the control group due to the intervention only. That is why we have a control group and we have an experimental group. Pre-testing will be done for both the group. Intervention will be given only to the experimental group, and the post-testing will be done in both the groups. Now, with 100% of the confidence, we can say that the change that occurred in the experimental group is only because of the intervention, because we have controlled all the other extraneous variables, external variables that may influence the variable under investigation. So this we call as the pre-test, post-test design, or before after design. In some cases, we may not be able to do a pre-testing. For example, we want to test the psychological impact of flood or any event like that, natural disasters. So it's not able to do a pre-testing in that case, because that has already happened. The phenomena is occurring naturally. But we are giving a counseling for all the affected person. We are doing some other interventions also for the affected, and we are able to do the post-testing. There also we can have a control group and the experimental group. We randomize the whole subjects into the control group and to the experimental group. Randomization is there. And post-testing is not possible because the phenomena has already happened. And the intervention we give to the experimental group, no intervention to the control group. The post-testing will be done in both experimental group and control group, till we are able to say that the changes that are taking place in the variable of the experimental group is only because of the intervention, because that changes has not occurred in the control group. So this is how the second design, we call it as the post-test only design or after only design. So this is done. We are still able to do an experimental study without a pre-testing. All the 3 elements of the true experimental design is there. We have an experimental group and we have a control group, and intervention is there, and we are doing the post-test also. With 100% confidence, we are able to say that the change has occurred in the experimental group only because of the intervention, because no changes occurred in the control group because there is no intervention. These are the 2 important primary designs. Now there can be some problems can occur in this design. For example, we are doing a pre-test post-test design. This is the first design that we have discussed, pre-test post-test design. So in this particular design, what happened is we are For example, I'm doing a study in your classroom. I've divided the classroom, randomized all the students, 50 students, 25 in the experimental group and 25 in the control group. And I'm doing a pre-testing. And after that, the control group, I'm sending you to the library. The study is about the effect of an education module in changing the knowledge attitude of BSc nursing, third year BSc nursing students about the COVID protocol. So that is a study. So I'm doing a pre-testing for both the groups. Questionnaire is distributed, you are answering. I'm sending the control group to the library and the experimental group in the classroom itself. And for the 25 students, I'm taking a 2-hour class using PowerPoint presentation and a lot of demonstration, etc. about the protocols, PPE, wearing, all those things I'm just teaching. And after that, I'm just calling the control group also, experimental group also together and doing the post-test on the next day. But on my surprise, what I found is the knowledge and attitude, or the knowledge of control group also increased significantly along with the increase in the experimental group. My expectation is there should not be any change because the teaching is not given to the control group. But on my surprise, the result is that there is a significant increase in the knowledge of the control group also. How this occurs? This can occur mainly because the pre-test, there are so many questions are there, and naturally for the student they have some curiosity. So when they are going to the library, they may see some textbooks, journals, etc., and try to find out the answer for this. Or when you are going to the hostel, you'll ask your classmate what was taken. Just give me the notes. Let me read, or you will discuss with them and gain knowledge. This can happen. So now this is a bias. And here I cannot say that the changes are only because of the intervention alone, because some biases occurred in the control group. How we can control, overcome this particular error that may happen in the pre-test post-test design. And this is by a design called as the Solomon 4-group design. What is Solomon 4-group is, we will select simultaneously 2 experimental group and 2 control group. Okay. And pre-testing is done to 1 experimental group and to 1 control group. Whereas no pre-testing is done for the second experimental group and the second control group. And in particular intervention, whatever it is, mainly happens with the not the pharmacological interventions, but mainly with the educational interventions or some form of performance intervention, opinion. So these type of interventions, psycho, behavioral, social intervention, this can happen. The intervention will be given to the experimental group, both experimental group 1 and 2, but no intervention or placebo intervention to the control group 1 and 2. And the post-testing will be done for all 4 groups. Now we know that whether the pre-test has influenced the post-test, whether the sharing of knowledge is done, and whether the changes has occurred only because of the intervention. This is how we overcome that particular defect, and this we call as the Solomon 4-group analysis. Now, one of the important disadvantages for this study is we need a large number of samples, because as I mentioned before, when we calculate the sample size statistically, if we get the sample size as 100, that 100 is needed in all 4 groups. And the pre-test post-test design, we need 100 in the experimental, 100 in the control, 200 subjects only needed. Whereas in Solomon 4-group design, we need 400 subjects, 100 in each group. So if there is a problem with the actual subject, for example, in some studies, patients, we are doing a study on breast cancer patients. Within 1 month, sometimes we may not be able to get 400 patients in our hospital. So these type of problems can happen for the Solomon 4 group design if you are doing that particular study. Otherwise, this is a very good design to overcome all defects of the pre-test post-test design. Now, this fourth true experimental design we call as a factorial design. Now, this design we use when we want to test more than one variable in a single study. Because in the pre-test post-test we are studying only one variable. But if we have more than one variable to test in an experimental study, can utilize factorial design. Example, in this particular design, I'm just testing the temperature and lighting. How the temperature is influencing the learning effectiveness or readiness of students in a classroom. At the same time, I want to study how the lighting influence the learning readiness of students in a classroom. So I'm exposing the first group of students to temperature at 25 degrees Celsius for 30 minutes, and I'm measuring their learning readiness. And then they are exposed to 45 minutes and I'm just measuring their learning readiness. And then again, I'm exposing them to 60 minutes and measuring the learning readiness. And another group of students, I'm exposing them to the lighting of 50 to 20 candles per minute to 30 minutes, 45 minutes, and 60 minutes, and I'm measuring their learning readiness. So this is how we are doing the factorial design. There are so many advantages associated with the factorial design. Well, see, these are the main advantages. It is possible to study the main effect. That is, either temperature is a main effect, lighting is a main effect, and along with that, interaction effect of different independent variables in a single study also can be. And the second advantage is that it is possible to test several hypotheses in a single study. Now, the effectiveness of, there is a significant increase in the learning effectiveness of students when they are exposed to temperature at 30 degrees Celsius, at 45 minutes, and at 90 minutes, for example. So this can be tested. Several hypotheses can be tested. Similarly, for the lighting also. And the third advantage is that comparison and finding out of which independent variable is more effective is also possible. Lighting is more effective or temperature is more effective. So this comparison is also possible. So these are the major advantages of the factorial design. At the same time, there are two disadvantages also to be discussed along. First disadvantage of factorial design is that a large sample is needed according to the number of independent variables to be manipulated. I have mentioned in the Solomon 4 group analysis itself, a large sample is needed. Here we need a large sample for temperature, another large sample for lighting, etc. So a large sample is needed for factorial design. Again, less equivalence as different subjects are exposed to different interventions or conditions. For example, one group we are using for testing temperature, entirely another group for testing the lighting. So there can be less equivalence. How we can overcome these disadvantages and make a study more scientific is by using another design. That design is called as the crossover design or repeated measure design. So what is crossover design is it's a modified factorial design which expose the same subject to more than one treatment. Example, if you are taking 50 students in this classroom, we will not divide them to 25 or 25 or 50 or 50, and the same 50 we expose them to different temperature and different period of time, and the same subject will be exposed to a lighting also at a different period of time. So the total number of subjects can be half. Okay, so number of subjects needed for the study is less compared to factorial design, and more equivalence also there because the same subjects are exposed to different variables. So that is why those two disadvantages of the factorial design can overcome in the crossover design. So when the same subjects are exposed, it ensures highest possible equivalence among subjects exposed to different conditions. This we call as the crossover design or repeated measure design. Now, as a whole, for the true experimental design, what are the different advantages of a true experimental design? So here we are considering about the pre-test post-test design, after only design of the post-test only design, Solomon four-group analysis, factorial design, and the crossover design. And what are the important advantages of all these two experimental design? The first advantage is that this is the most powerful design for testing cause and effect relationship, because we are testing the cause and effect, isn't it? And this is the most powerful design because the intervention is very well planned and executed. We have a comparison group to compare, and the 100% control is there. Even no influence of any other external variables, everything is remain as constant. So we can say that this effect is only because of this particular cause. So that is the most powerful design for testing cause and effect relationship. Again, can be performed in all settings, as I mentioned in the introductory class. It's not only in the laboratory. We are able to do experimental design in quasi-experimental setting like a hospital or an industry or a school or in a community setting also. So irrespective of all the setting, we are able to perform experimental study. Then the third one is the causal relationship can be studied, not causal relation, it is a causal relationship can be studied with 100% confidence. And again, it permits a repetition of investigation because this is conducted under the ideal conditions. If we are doing the same study, repeated the same study in similar subjects, will get the same result. Will not be any change at all because the replication is 100% for this type of studies because it is a true experimental study. So these are the advantages. And we have to remember, even though it is the most powerful and it has a lot of advantages, it is associated with a few disadvantages also. So in the last slide, we'll see what are the disadvantages of a true experimental design. And these are the disadvantages of true experimental study. First is a problem called a manipulative problem. Second thing is the ethical problem. And third one is impractical. And the fourth one, we call it as the Hawthorne effect. The first one, as I mentioned, it is a manipulative problem. What is a manipulative problem means many variables are not amenable to experimental manipulation. For example, we are taking an independent variable as gender. but we cannot change the gender and see for the same person. Okay, you be here as male for some time, and we cannot make the same subject into female gender. Intelligence, we cannot change that variables, independent variable. So this we call as a manipulative problem. In that situation, we cannot do an experimental study because we cannot alter or change independent variable. This we call as a manipulative problem. The second disadvantage is the ethical problem. Manipulation or intervention may cause harm to subjects participating in the study. For example, sometimes we have to take a blood samples by giving unnecessary pain for the study purpose. Or we are testing a drug that may cause a lot of disadvantages or side effects. There's so many studies were done in the regional cancer center Trivandrum for some 15-20 years back, but that has produced a lot of side effect on the person subjects. And another example I can give is, we want to test whether smoking causes lung cancer. That's a classical example. Smoking causes lung cancer. How we can do an experimental study is, we have two groups, an experimental group and a control group. We have 500 subjects in the experimental and 500 in the control, all healthy person. And we ask the 500% in the experimental group to smoke 2 packets of cigarettes per day for 5 years. And we'll see how many of them will develop lung cancer at which period of time. So this is the actual true experimental design. But whether we can tell this is unethical. So these type of ethical issues are there which hinder a true experimental design. In that case, we cannot do a true experimental design study because of the ethical problem. Third thing is impracticability. So we will not get permission from authorities, mainly because of the suspicion or some other, they may feel that it is not nice to give permission. For example, if you want to do a study on COVID patients, they may get a suspicion that whether this data collected will be shared with others, whether the person's personal information will be misutilized, whether their privacy will be affected. So many doubts will be there. And many of the time, because the study may damage the reputation of the institution, institutional authorities will not give permission for doing the studies. And many studies in many institutes have not given the permission because their data will be misutilized or the reputation of their damage will occur. Damage to their reputation will be occur. So because of that, they will not give permission for the study at all. So it becomes impractical. And along with that, the last disadvantage we call as the Hawthorne effect. Now, on one of the question papers in few years back, a short note was asked in the university examination only about the Hawthorne effect. Because that's important. This Hawthorne effect, this is based on a research study that was conducted in an electrical factory called Hawthorne factory. There, an experimental study was conducted. They want to test at what condition the productivity of the employees become maximum in the electrical company. That was the study. So they offered so many things to the employees, for the workers. So given frequent coffee, monetary benefits were offered, and so many things were offered. and so many conditions, rest period were given, all those conditions. But what they have observed is, even there is no benefit or maximum benefit, even into the experimental group or control group, always the production was maximum. There is no effect with any of these monetary benefits or any of these beneficiary based things. So why this happened? Because all the employees were aware that they were a part of a study and their activities were studied and observed by an authority, and they want to study the productivity of the employees. So all of them, irrespective of the conditions, worked to the maximum ability, the maximum production. So this effect, that if the subject is aware about the subject status in a study, that will influence the study. This effect we call as the Hawthorne effect. And this can happen in any experimental studies. The subjects are aware that they are the subject of a study. Irrespective of the intervention, the effect will occur. So in order to prevent this, what we can do is we can do blind studies. So that is how we can overcome this Hawthorne effect, by doing blind studies. Now what is blinding is, we'll blind, or we will not give the information that they are the subjects in a study. That is blinding. Blinding itself is, there are three types of blinding: single blind studies, double blind studies, and even the triple blind studies are also there. What is the difference between this? Single blind study means the subjects are not aware. We will not give the complete information that they are the subjects of a study. But there are ethical guidelines are there. Within the limits of ethical guideline, we will give information, but they are not aware. So there will not be any voluntary manipulation of the study. It is single blind. What is double blind is that, for example, we are doing a drug trial. There is a master investigator is there, and under the master investigator, there are several investigators are there and subjects are there. We have experimental drug and the placebo drug. And here we will not inform the primary investigators also who is the subject, who is the control. So the primary investigator are also blind. That is a secondary thing. Now what is the tertiary blind study is that even we will not, the primary investigator will not give the information like which is the actual drug and which is the placebo drug. So that is the tertiary blinding. So here only the master investigator know that who is in the experimental group, who is in the control group, and what is the exact intervention and what is the placebo intervention. And the primary investigators will do all the work and they will submit the master investigator. Master investigator will analyze. So this is a triple blinding. So blinding can be of any of these three types according to the nature of the study and according to the effect, Hawthorne effect that can occur, we can blind. So this is a Hawthorne effect and blinding in studies. This was asked as a short note once, but not very common. Okay, so these are the disadvantages of true experimental design. Now this is the whole thing about the experimental design. So in a nutshell, I can say that this is the most powerful study, and true experimental design can be conducted in any setting if these have three important elements. And these three elements are, what are this? It's a manipulation or intervention, two groups, experimental group and control group by randomization, and the control of all the variables. So if These three elements are there. We call that as experimental study. And there are so many experimental designs are there. The primary designs are the pre-test, post-test design, and the post-test only design. Second one is the post-test only design. And other designs to overcome these are the Solomon four-group analysis. Then we have factorial design, and then we have a crossover design. And still more designs are also there, but these are the 5 important true experimental design we utilize for nursing research. So we'll stop our class with this, and the next class will continue with the quasi experimental studies.